start with introduction.
So my name is Melissa and I'm a nurse at Nairobi Rakusei. This is a mental facility.
My name is Calvin Eria. I'm a nurse assistant at Nairobi Rakusei Mental Hospital.
Okay. Is there, or do you offer services like ambulance services or whatever form? Like if someone can't get from where they are to come here, is there a way you can get them where they are?
We don't have an ambulance services for now. So what we'll advise the family to do, they can seek ambulance services service provider from a different facility, then bring them here, or they can just bring them here themselves. Yeah.
What if they don't have family? Maybe they stay alone.
The person?
Yeah, the person just stays alone.
The person stays alone. I think in some scenario, though it's usually a very dangerous one, but we can mobilize the staffs. We go there, we can calm them, restrain them, and get them to our facility. Though that one is usually a very dangerous option. But now if the only one we have, I think we can go for it.
Okay. What is the triage process like, or what would be the first steps?
I told you there are two types of admission. There's voluntary and involuntary. So the first thing we do in the triage process, we have to get the history, either from the patient or the relatives. So the first thing, normally if it's involuntary, most of the patients are never happy.
Yeah, of course.
They're very agitated, very aggressive. So the first thing we try and do is to calm the patient down. So once they are calm enough, we can get the history from them. And in other cases that we find this person is very, unable kabisa to calm down, we sedate them, we give them something to calm them down, just like a medication to assist in the process.
How would you differentiate this is an emergency case and this can wait a while?
So in a society, there are two types of emergencies. There's someone who can cause harm to themselves, that's a suicidal patient, and one that can cause harm to the rest of to other people in the environment. So those two people, we have to put close watch to them. So there's a form, it's called a suicidal form. So you have to closely check up on that patient, and in our rooms, you'll find in these rooms there's no place. You'll see me working with keys. In their rooms there are no keys. There's nowhere that they can lock themselves in, because you'll find this person can lock themselves inside and harm themselves.
So how many professionals do you have in the facility?
We have a psychiatrist, the doctor, a psychologist, a nurse assistant. We have a chef. We have housekeeping.
An anesthetist.
And
The management.
And then the management.
Okay. There's usually a lot of misunderstanding when it comes to or what people understand sedation to be, or when you have to restrict a patient because they're aggressive, or could you tell us what necessitates sedation or restricting a patient, and what do you take into consideration? How do you do it?
So when it comes to sedating a patient, I told you before, we look at two factors: the patient to not harm themselves and not to harm others. So with sedation, it's like putting a patient to sleep in just simple terms. So we put this patient to sleep to avoid now endangering themselves or other people. The other question was?
Like when you have to restrict them when they're being aggressive, or what necessitates?
It's for restricting them. It's just them being aggressive towards themselves and other people. So we just try and confine them in one place to avoid them hurting other people or themselves. Mostly other people.
The people who feel like it's violent or it's interferes with their rights, or like what would you say about that?
I think usually you must first consult the doctor, the doctor is the one who gives instruction on what amount of sedation you are giving the patient, and when. So giving the sedation, most of the time it looks like we are harassing them, like you say, like we are infringing on their rights. But now it's usually under instructions, and it's the right thing to do. Because now if we don't, now just like my colleague has said, we may end up causing more damage than it would be.
Yeah. I also wanted to find out a bit about your pricing, just in case anyone is interested in coming here.
So the pricing, it's 6,000.
Yes,
6,000 per night. And then the charges we charge every day. So for the bed it's 6,000 per night. For the nursing care it's 500. For the doctor's consultation is 5,000. For the psychology fee is 4,000. And then now the medication depends with what medication you're under.
Okay. And if someone wanted to, maybe therapy services, any psychological services, can you make same-day appointments, or how long do you have to wait for an appointment?
With the appointment, we have to, because it's someone else's schedule. So we have to consult with the psychiatrist or the psychologist, so we can know how their schedule is, and then we can book you an appointment according to their schedule.
Okay. How flexible would you say is a patient in deciding what medication they're most comfortable with?
I don't think that is an easy one. Because now you can't give the discretion of choosing a medicine for the patient unless they are more conversant with the medication they are supposed to be taking, or maybe they know the alternatives, whether you have two medicines serving the same purpose, and they can choose the other one when they are fully aware of what they are choosing. I think they can be allowed to choose.
What's the hardest part of the job? And when it gets very hard, how do you go?
For me, I think the hardest part is when a patient becomes emotional and they start begging and trying to ask you not to do something. You see them crying, but at the end of the day you have to do your job and do what's best for them. Because the injections we give, of course you don't want to inject anyone, but it's for their own good at the end of it, it's serving a better purpose than they know at that moment. So I think the hardest part for me is when someone gets emotional and starts crying, things like that.
And how do you
cope? There's nothing I can do. I just explain. It's good. I just set the boundaries from the word go. Even if you cry, there's nothing I can do. You just let them know then. Because if you start bargaining with them, they know, so I can get away with this and that. So I just tell them there's nothing I can do. And I see them getting hurt, but I know it's for a better purpose at the end of it.
I think the hardest part of our job is usually when the patient is not getting better, and we have to discharge them. They're going home, and we are feeling like you haven't met our objective. So that one won't give you peace, because you've been giving in your best, trying to help the patient get better. But now he's being discharged. The patient is going home without being stable, still the same way she or he came. I think that one would be the hardest part of my job.
How do you cope with that?
I think that's why it's the hardest. We fail to find a solution, because now if they're getting discharged and we haven't met our objective, it becomes a problem.
I had a different question, because I've noticed you said you have housekeeping, you have a chef. Do you train them? Do you have workshops so they know the kind of space that you need?
Yeah, I think they're briefed on how to now. You've seen them chipping in when you need them. I think they know how we can restrain a patient. They know when to refrain back and go back when the patient is getting violent and how to approach them. I think we've made them aware. Most of them, most of our staff here in the accountant and all that, I think they are aware how we can approach a patient. Basically, basic concepts of how we can handle our patients when they are required. Yes.
Okay, and in line with that as well, like, have you you took a nursing course here? Did you specialize in mental health, or how did you find yourself in that space?
So in nursing, the course I took, it's called Kenya Registered Nursing.
Yeah.
So there are different courses in the course there are different courses. So you take mental health as a course on its own. Yeah. So.
But you didn't like specialize in it, or you just found yourself?
I just found myself, but I took it as a course in college.
Do you think like what you learned was applicable
when you take it, when you do nursing, there's something called rotation.
Yeah.
So you go for rotations. So if you've done the mental health course, you go for the mental health rotation. Yeah. So you prepare yourself even before you get into the field.
Yeah.
So we go to Mathare. That's the general place for practicing. So that's why I went for my practice.
Do you have like a certain inclination to, like, if someone offered you a job between here and maybe Nairobi Hospital, general clinical practice, like, would you have any inclination towards mental health?
Now as I'm doing it as a job, I think I'm more inclined to it now that I'm getting to actually practice what I did in theory and what I saw as a student and couldn't really handle it. Now that I'm doing it as a professional, as a registered nurse, I think I'm getting more inclined towards mental health.
And for you?
I think I'm also a trained nurse assistant, and you've also been trained how to deal with we've done psychiatry as a unit, and you've also been we've done our clinicals in our psychiatric unit. And I've also worked there, so I think I've gained much experience in handling this patient in my capacity as a nurse assistant.
Do you have any inclination to mental health?
Yeah, sure. Yeah, because now you see it gets interesting getting the patient getting violent. Sometimes you're laughing with them because now these are stable patient. You can interact with them. You can, when they're stable, when they're okay, you can talk with them, unlike the other patients who are bedridden and like that. So there's a lot of passion that I've gained and interacting with these patients and knowing and listening to them, their stories, and I think that one makes the profession very interesting. Yes.
Like, what's the one message you tell people with mental illnesses out there that are too afraid of reaching out or coming to the facility?
One, I know someone who's going through a mental illness, they won't feel alone. So one thing I can tell them is that they're not alone. And once you come to a facility like this, you can all see it's like a homey place. It looks like you're just like at home. So the only difference is that you get medication at certain times, but the rest of the things, you watch TV, you have people to interact with, and then you have a psychologist who talks you through what you're going through. So I'll just advise someone, whatever don't go through whatever you're going through alone. Just seek the help that is needed, and welcome to Rakusei.
I think for me, I'll say we have had many patients with mental issues, and most of them have been helped, and they're okay now. So whatever they're going through, however big they may seem to them, we still have a solution for them. We have professionals who will help them get better. We have doctors, we have nurses who are passionate about whatever they are doing, especially here. So they are most welcome. We can always help them wherever we can, and they can get better.
Is there a myth that you'd like to debunk? Is there a one thing that you
maybe like top 3 myths?
Yeah, that you'd like to tell them that's not true, that's not what happened?
Yes. I think one of them is that it's associated with sorcery or witchcraft. I think there is nothing like that. You can always treat. Every mental illness is curable, is treatable. And there is nothing like witchcraft to it. Those are imagination. So if we are thinking maybe there is witchcraft, maybe we can help. We still can help. And also maybe genetics or maybe curses. I think there's a myth that have been there. You can be thinking it's a curse, but it's a mental problem that can be helped or can be cured or can be. We can help get better.
Yeah, people. I've seen people have been thinking that when you go to a mental facility, you'll be sedated all through. You'll be asleep the whole time, but it's not true.
Yeah.
You come here with the sedation is just to stabilize you, not to get money from you or to all those things that people are saying. It's not true.
Yeah.
You're just sedated for you to be stable.
Yeah.
So.
Do you guys have voluntary, like can someone come and volunteer?
Like a psychologist.
Any
capacity.
I think that one we must check with the management. They will give her the direction.
Can one use public names, no?
To here?
Yeah.
That's how we come to work.
I also tell them how to get here.
Right.
How to get here?
Yeah.
Oh, so from town, if you're using public names, from town, you go get a matatu, 125, that's matatu going to Rongai. Then you alight
So you take it from railways?
From railways, So you take it from railways, you get to Bomas or Galleria, alight from there. Then outside Galleria, there's matatus that's number 24. Karen.
Yeah, current.
I'm not sure about the number. And then you take a matatu from there. Once you get into the matatu, you alight at Fair Acres. From Fair Acres, you can take a motorbike till Fana Road.
Okay.
The soldier at the Fana Road will just show you where the mental facility is.
Okay.
He'll tell you about the Uber.
The Uber. I think the Uber, if you're taking it to Fana Road, then you just instruct the Uber driver, Fana Road, then you pass to the barrier, then the second grey gate on your left.
Okay.
Yes.